Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. We're recording on April 16th, 2025. As a heads up, we have two upcoming insider events I want you all to be aware of. Next week on April 23rd, we have a conversation with Brady Post on site-neutral payments. And then on May 29th, we have another insider event on the FDA's first 100 days under the second Trump administration. Moderated by Rachel Sachs, the panel will include Richard Hughes IV and Artie Rye. Today, I'm joined by Bob Herman from Stat News to talk about the M&A space in healthcare. Bob is a healthcare business reporter at Stat News, and his work previously appeared in Modern Healthcare and Axios, one of the OG business reporters out there. So, Bob, welcome to the program.
Thanks for having me, Jeff. Glad to be here.
I had you on because I'll admit, I still got that dog in me, but I'm not tracking this stuff as much as I used to. So I thought it'd be great if you could tell us about the general state of deals in the healthcare space. Is M&A cooked?
Yeah, I mean, it has changed a lot from like the early days of the Affordable Care Act. You know, when President Obama signed the ACA into law more than 15 years ago now, it really unlocked like every kind of player to just start trying to buy or sell whatever they wanted to. And you just saw a flurry of deals everywhere. And there's especially the case with hospitals because the ACA encouraged what many would call coordination among the different providers. And it just led to just this huge boom in hospital mergers. But it's ebbed and flowed a lot. You know, when COVID happened, a lot of companies were just suddenly had a ton of cash and just started buying everything. So like the first year of COVID, like 2021, there was just so many deals everywhere. And since then, it's actually slowed down a little bit. You know, President Biden got elected in 2020, took office, and there was a very clear antitrust effort in the Biden administration. You look at FTC when Lena Khan was leading it, Jonathan Cantor at DOJ. There was a very clear presence there that they wanted to clamp down on what they thought were anti-competitive mergers in healthcare specifically. And so there was a lot of pushback on some of those deals, especially in the hospital space, some payers. It's ebbed and flowed. There's still a lot of money flowing around, private equities everywhere, of course. But yeah, it's ebbed and flowed.
You touched on a point that you've done a lot of reporting on how much money hospitals made during the pandemic or like how much reserves they had. Can you dive into that a little bit? Because I always thought that was interesting and also kind of beats against the hospital narratives of that we're working on thin margins and, not all hospitals are the same. But can you touch on that a little bit as well?
During COVID, many hospitals were in a tough position, right? Because when the pandemic first started, nobody or pretty much everybody stopped going to the doctor, to the hospital because it was not safe to do so. So there was a cash crunch there, but Congress was like, wait, this is a huge problem. Like, let's make sure hospitals still have money flowing in, even though people aren't going to get care. And so Congress authorized billions and billions of dollars to go into hospitals. And so hospitals did really, really well those first couple of years, just surpluses that were gigantic. And there were some years afterward where things became a little bit tougher, costs got higher, and they were relying a lot on, travel staff, travel nurses, and that was more expensive than having permanent employees. But this idea that hospitals are withering on the vine, that's just, it's kind of fictional. It's never really been the case. It's not to say that some hospitals haven't struggled. That's absolutely true. Especially rural hospitals, small hospitals that, treat more poor elderly patients. But overall hospitals have, especially the big mega systems where, there's this consolidation over the past decade, they've been doing fine. They're sitting on large cash reserves. Some of their operating margins are thin, some are operating a loss, but it doesn't mean that they are dying or at risk of going bankrupt.
Kind of going back to the M&A space, you talked about Lena Khan and the FTC and the DOJ under the Biden administration. From what I recall, they tried to scrutinize some of the bigger deals. Is there a sector or type of deal that's happening that isn't getting a lot of attention?
It's a good question. The Biden administration did focus on a lot of bigger deals, especially among the big tech companies. But they went after a lot of what I thought were pretty clear, anti-competitive healthcare deals too. You think about there was this big hospital deal in not big, but it was local. Novant Health tried to buy this hospital system around the Charlotte area, and the Biden administration went after it. It was just like the low-hanging fruit, right? But they really didn't go after some of the the cross-market mergers, where it's like these big hospital systems that were not necessarily in the same areas, and they were just merging because they didn't overlap much. So the Biden administration didn't go too much after those. Now, there are, I think, other areas that are flying a bit under the radar, and it's this idea of vertical integration, right? Where it's instead of hospitals buying hospitals or insurers buying insurers, it's hospitals buying doctors or insurers buying doctors. Something that's just not totally their line of business, but they work with them a lot. Maybe they're suppliers to each other. And those deals are still going on pretty frequently. You think about United Health Group, the largest healthcare company in America. This has been their strategy for like the past decade, right? Where they realize that they have kind of, and this is across health insurance writ large, where we've kind of reached this critical mass where it's very, very hard for insurers to buy competing insurers because they're already really concentrated. Those deals blew up back in 2016, I think, when Aetna and Humana tried to merge and Anthem and Cigna tried to merge, and that was just wildly anti-competitive, and the DOJ shut those deals down. So trying to do that again is going to be very difficult. So insurers have pivoted. They've wanted to get more into care delivery, and that has been United's MO for a while now. Think about, we reported earlier this year, United continues its buying spree of outpatient surgery centers, which is also a big focal point for hospital systems as well. United's also continued to buy more into physician groups and anything that's like tangential to maybe a business thing, like pharmacies. That's another one. So anything that complements their business, anything where they could buy from themselves, right? Where it's, if you're a United Healthcare insurance member, it makes a ton of financial sense for the company to send you to a United Health Group doctor or a United Health Group pharmacy. So vertical integration has gotten way more attention, but it still flies under the radar because it's happening so much. And some of the deals are so small that maybe they don't like catch the big national headlines, but they make a big deal for the companies that are buying them.
Yeah, I can't remember the exact year. I think it was 2018, but you can correct me if I'm wrong, when the CVS Health Aetna deal went through, which was a big vertical integration. And your colleague, Zachary Tracer, and myself back in 2017 both wrote about Optum, who was owned under United Healthcare, and just the wave of transformation. They have changed themselves to a service company, or like the way that their portfolios changed even back then from 2012 to 2017 was quite stark, and I'm sure that's potentially still continue.
Yeah, and in the same vein, you think about all the PBM mergers too, right? Like, because Cigna bought Express Scripts, that was the major one, and then even before that, United had bought Catamaran, which was folded into Optum Rx, and then CVS was already a big PBM as the result of PBM mergers from the late 2000s to 2010s. So PBMs is another space that's all related to that. As you'll see, insurers are no longer just insurers. It's way more complicated than that.
Yeah. So there was a moment this year where the FTC, I believe, please correct me if I'm wrong, kind of reaffirmed some Biden era proposals on the antitrust level. And so my question to you is, based on that, unless that has changed, or unless there's been any statement, which it very well could have changed, this morning or to the time we publish on Friday, looking at that vertical integration, is there any implications for that, of that reaffirmation of those proposals versus what you're seeing?
Yeah, so the Department of Justice and the Federal Trade Commission have both made it clear that they want revamped merger guidelines. They've wanted to take a closer look. And honestly, like when Lena Khan was at FTC in particular, she kind of got support from both sides of the aisle on this. Republicans and Democrats are both like, it makes a lot of sense that more scrutiny should be placed on some of these deals, especially the vertical deals. I think vertical deals have still not really been challenged all that much. You think about, like, currently United Health is trying to buy Amedisys, this large home health and hospice chain. But DOJ is suing not on grounds that it's because of its vertical nature. It's because United already owns a large home health and hospice company called LHC Group, which it bought a few years ago. And therefore, having that and Amedisys would create too much market power for United. So that's not quite a vertical merger challenge, but there is this idea of wanting to challenge more mergers along that line. I spoke with Jonathan Cantor a few months ago, the outgoing DOJ antitrust head under Biden, and he was very concerned about this idea of healthcare companies becoming platforms. That means it was basically a vertical integration was becoming a major problem in his eyes. Where by becoming vertically integrated, there is the idea that maybe things do become more efficient. Maybe care does get coordinated a little bit better. But you also there's so many financial incentives to prefer your own company. And that is just it could be very anti-competitive. It could lock out competitors, but also are you directing people toward the best options for their care? So yeah, I mean, I think there's still a lot to be. We don't really know how this new Trump administration antitrust apparatus is going to go into effect. We have Andrew Ferguson at FTC leading it now, and Gail Slater at DOJ. And I mean, they have still been pretty vigilant in making sure that there's merger enforcement. It's not like there's been this like totally like hands off, let corporate America run wild idea. But I don't. It's still early days, and I don't know what that means. But overall, I still think deal volume is still down a little bit because during the Biden administration, everyone was just like, we're holding off because there's a chance that we could get challenged here. And I don't know that it's just fully resumed. But I know a lot of like the consulting firms and law firms that want deals to happen because it's a little self-serving for them. But they want these deals to happen because a lot of companies, especially private equity companies, are sitting on companies that they want to unload now. So I think there's a lot of chances for deals to come back up, and whether there's strict federal enforcement of some of these is still an open question.
I am interested. So you and I are talking about vertical consolidation. We've talked about mergers and acquisitions and horizontal consolidation for a while. Do you get the sense that maybe not the general public, but the generally informed public or like people interested in healthcare, is this something that's on their radar, or is this a really wonky topic for the most part?
I think there's that meme. Why not both? Right? I think
Yeah.
it could be both.
Yes.
Yeah, right. Yes. Vertical integration is wonky because it's when you think about mergers, I think most people just think about like competitor A buying competitor B, and that's the deal. When this is, you look at like down the chain, who could they be buying instead of their competitor? But it's very clear that vertical consolidation has caught the attention of antitrust enforcers. We saw that with Jonathan Cantor and Lena Khan, and you still see it now, I think, with Trump administration antitrust officials. And it's also caught the attention of lawmakers too. And I want to give another good example of this, one that definitely has flown under the radar, but it's picking up now. And that is, you have these large wholesalers, these medical supply and drug wholesalers. You think of Cardinal Health, McKesson, and Cencora, which used to be called AmerisourceBergen. They just run most of the sourcing of drugs and medical products as distributors, and they are getting into care delivery. All of the big three have all bought majority stakes in certain physician groups, oncology groups, eye doctor groups, certain specialties where they rely on these physician administered drugs. Maybe they're injections, IV administered. But as a wholesaler, you can make a whole lot of money by suddenly owning that physician group, supplying them with those very profitable medicines, and retaining more of that profit then as the parent company. So that's another area that is, again, this idea of vertical integration in a different way, completely different way. But that has attracted the attention of lawmakers too. Elizabeth Warren has sent letters on this, concerned that it could be anti-competitive. Vertical integration has been the way for hospitals, for insurers, for other groups to diversify, because they might have felt tapped out elsewhere. And now I think people are starting to realize that maybe this has some anti-competitive effects of its own.
Well, Bob Herman, thanks again for joining us today on Health Affairs This Week. Is there anything that you want to tell our listeners that you got going on at Stat News, or any specific coverage that you want to point them to?
Yeah, I mean, I'm biased, but Stat has really just been doing a lot of great. My colleagues are just they're really the best at what they do. And, with the Trump administration coming in, and there kind of being chaos across the federal government in terms of people being laid off, certain agencies just completely being eliminated. It's the way that I've been trying to stay informed as well. So yeah, anything on the federal government is just like firmly in our radar right now. There's just so much change going on there. Yeah, and of course, that costs money. That's why, we have Stat Plus, which is our subscription. And I know we all kind of have subscription fatigue to some point, but I do feel like it's a pretty good value, because we do put out what I hope is very diligent, trustworthy healthcare news. And for anyone who wants, free stuff, we have free newsletters as well. I have one, Healthcare Inc. You can sign up at, find the sign up page at statnews.com. And that's a great way to just stay informed, through a lighter touch too.
Yeah. Are you making those memes at the end of it?
I am. Yeah.
Do you find the reporting harder or the memes making harder?
Oh man, the memes honestly are harder. It was one of those things when I started the newsletter, I'm like, oh, this is gonna be so much fun, having a meme at the end of every issue. And it's become increasingly harder. I don't know. I completely did not think about, doing this over time, but it's still fun. It's still fun. Just a challenge.
I look at it and I am impressed because you're trying, just from a joke format perspective, trying to get so much specific information in there. Thanks for being honest that it's a challenge.
Oh, it's not easy. Yeah, some people have it, and kudos to them. Hopefully, I'm trying. It's just there's so much news that is like it's a lot. So any way that you can like bring a sense of humor to it, hopefully, will help maybe people understand, but also bring a little bit of a laugh.
Fantastic. We'll put the link to Stat and to the newsletters in the show notes, so listeners can check that out if they haven't already checked it out. Bob Herman, thanks again for joining us today on Health Affairs This Week. And if you, the listener, enjoyed this episode, please send it to the deal maker in your life. Thanks, and we'll see you next week.